It was my annual mammogram. And this year, Henry Ford offered a 3D mammogram. They called me and they said, it's not looking like last year's. When I received the phone call, I was at PetSmart, but I had my Bluetooth ear set on. So when the phone rang, I just answered it, and it was the nurse. And she said, can you talk right now? She said, well, the test came back and it's confirmed cancer. And the people are just cutting the dog's nails and shaving dogs, and I'm in the corner having a meltdown. As it started to sink in, I gave it a good 30-minute cry. After that, it was time to fight. And that's what I did, and that's what I told the rest of my family. And it was so convenient that Henry Ford Wyandotte was so close.
Cancer diagnosis is one of the hardest diagnoses you can give a patient. Once you give a patient diagnosis of cancer, they need support. We're not talking about just medical, but social support. That's what the oncology department and the cancer programs becomes important in the life of the patient. Cancer has been always associated with death. In today's age, cancer is not associated with death as it used to be, because we have a lot of means to help these patients. Sometimes we can give cure for majority of these patients. Every cancer patient wants to get their care at an institute where they get complete care.
I think it's really important for the community to have access to oncology services locally, because most people want to be close to home when they're receiving care. Medical oncology services, we've had them, but we need it more. The oncology across the country is an area that's growing. Ours is a comprehensive community-based program. So that means that our patients are going to get all of the primary and secondary services right in the Downriver community. We have world-renowned physicians that are delivering that care, and the outcomes are good. We truly know that the Henry Ford care differentiates because we're saving lives. People, when they're detected early, are getting good life outcomes.
My role here is to promote oncology for the Downriver community through Henry Ford Wyandotte Hospital in partnership with the Henry Ford Cancer Institute. The community is very close-knit, and they like to stay close to home. And I saw that this was a very huge opening in our community, that we could provide that high-level, high-caliber, world-class cancer care that Henry Ford has. And to bring it to the people here locally was more than I could have ever hoped to have done as a professional in this job. Giving to Henry Ford Wyandotte's oncology services really supports our patients in a couple of different ways. With the services that we can provide, it helps them with transportation costs, expenses of daily living, anything that helps them get to their end of treatment in a better, more whole way.
It's very important that people give to oncology services because there are a lot of supportive pieces that we want to put in place that aren't directly reimbursed by insurance. One of the ways that giving helps us is to create a nice environment that's healing. We'd also like to be able to expand some of the supportive pieces, and so by supporting us, you'll allow us to be able to grow the service even more. Partnering with Henry Ford Cancer Institute, I think the sky honestly is the limit because of all of the elements that we can bring together to actually try to cure the disease. But while we're looking to cure it, we're going to treat it as best we can.
Moving forward, I hope to be cancer-free, definitely. But I will always continue my care with Henry Ford Wyandotte. They really saved my life.